The director of Tasmania's Menzies Research Institute for the past 6 years has resigned to take up a post in New South Wales. Professor Simon Foote has led the institute through massive changes in size, budget and location. I spoke to him this afternoon about the future of medical research and healthcare in Tasmania. Simon Foote, welcome. You're about to leave, though, going to set up a medical school at Macquarie University in New South Wales. Are you cutting your time short here, or a magical opportunity, or any regrets?
So I've been here nearly 7 years, 6.5 years. I don't think that's short. If I was going to spend my entire life here, then perhaps 6.5 years may be a bit short. But no, I've had no regrets. I think that the last 6.5 years have been amongst the best 6.5 years of my life. I've really enjoyed it. It's been a real ball.
Now, you're not just going on your own, though. You're actually taking some staff and some work from Menzies with you. Who's going and what's going?
Yeah, so as well as running the institute, I've got a research lab that I work in, and we work on malaria, we work on a little bit of human genetics, and those guys will be coming with me, or many of them will be coming with me to Macquarie University, and we'll keep our research lab working up there.
So how many, what does your lab constitute? How many are leaving? At
the moment there's about 5 or 6 of us that will go up, myself included.
So what does that mean in terms of like malarial research? And I think there's also research into kidney disease in Indigenous communities. Will that no longer be done then at Menzies?
Definitely the malaria research will no longer be done. We'll take all of that with us and do that up in Macquarie. I'll continue to collaborate with people at the Menzies over the Aboriginal renal disease project. The statisticians at Menzies are extremely good, and we'll be working very closely with them to try and find genes that cause kidney disease in Aboriginals.
You got funding specifically for malarial research, didn't you? So is that funding naturally then going with you, and how much?
Yes, I'm in the process of trying to convince the University of Tasmania to let me take my funding with me. I'm sure there'll be no problems.
What do you see then? I mean, you're leaving at a time, though, with stage 2 sort of getting underway. You've been there with the stage 1 co-location with the medical school there. Quite a significant growth of the institute. Where do you see the future of the institute?
So the institute is going to actually have some of the best facilities of any research institute in Australia. We should, without any shadow of doubt, be able to recruit really good people going into the future. We should be able to do extremely good research as well. And I think that Tasmania will have the ability to actually compete both nationally and internationally, at a research level. We've pumped an enormous amount of, we've raised an enormous amount of money to actually build up Menzies Research Institute. This has benefited other parts of the university, and has benefited and will continue to benefit, the population of the state of Tasmania going into the future.
What was the size of the institute when you started, and what is it now? Well, sort of both in terms of staff and also in terms of revenue?
So when I arrived, there were about 65 people, and they worked on epidemiology, population health. They were a very good group. We've expanded that to close to 400 people now, with a wide range of different subjects. The budget when I arrived was about $4.5 million per annum. Last year we brought in $23 million.
What's your relationship been like? I mean, you're just over the road from the Royal Hobart Hospital. You've, as I say, you've got the medical schools that are co-located there, and you were keen to partner more with the Royal Hobart Hospital. That hasn't really happened. Tell us why. What's happened there?
Yeah, so we've had an interesting relationship with the Royal Hobart Hospital. There are some clinicians in the Royal that do some very good clinical research. Medical research is actually interesting. A lot of the medical research we do is very basic, working with cells and molecules, but all of us want to actually see that translated into the clinic to have some benefit for patients. And the best way to do that is to actually have a good relationship with the hospital, such that you can actually do things in the laboratory that then gets translated and can benefit patients. So I've been trying to generate a relationship with the Royal Hobart Hospital, and you're quite right. I mean, to a certain degree, it hasn't been particularly successful. We've had a large number of CEOs come and go over the time I've been here.
Is that what you put it down to? There's been sort of, how many have there been? I mean, you've been here for 7 years. How many CEOs have you seen?
There's been at least 6, I think, CEOs of the Royal Hobart Hospital since I've been here. And with each one, we've had a very productive conversation. We've got close to the stage of actually having an agreement, and then they'll disappear, and I've got to start again next time round.
What do you see? How would you see that being rectified then in the future?
So, just from my perspective and in my interactions with the hospital, there appears to be little sort of handover and little continuity in terms of management. And it would be good to actually see a board or some organisation that oversees the sort of transition of one CEO to the next. I think that would benefit other parts of the hospital as well.
Well, the hospital is not going through a particularly good time at the moment. There's significant budget cuts happening right across the health sector. You're a bit on the rise and rise at the Menzies Institute. How do you see public health at the moment in Tasmania?
Well, for a start, the CEO of the hospital at the moment, Jane Holden, she's very capable, but I wouldn't exchange jobs for her in a million years. She's got an incredibly difficult job. There's very little money going into the hospital. There's enormous restructuring that needs to be done. They need to actually get, as far as I can see, efficiencies. And as far as Tasmania is concerned, there's a north-south problem. It's very hard politically to rationalise healthcare across the state. That adds into the equation.
Well, where to from here then?
I think that nationally and internationally for that, I think we can't actually afford the level of service that many people sort of desire. And we're going to be, over the next decade, we're definitely going to be faced with more and more difficult decisions about whether to spend money on someone for a particular procedure or not. And I think going into the future, the answer to that question will often be not rather than yes.
Sounds like medical euthanasia.
Well, it's not necessarily euthanasia, but it's we're going to have a finite budget, and we have to spend that budget wisely. And we make those decisions already. For example, there are drugs that we don't actually have access to in Australia because they're too expensive. So those decisions are at one level or another already being made. I think we'll just see them being made more frequently into the future.
Simon Foote, we're out of time. Good luck for the future.
Thanks, Ellie.